Any drugs injected subcutaneously can give you injection site reaction, which can present as redness, swelling, or pain at the site of injection. It can sometimes be easily appreciable if the skin tone is light. However, injection site reactions can sometimes be difficult to see if the skin tone is different or darker. Here, the injection site reaction is marked with a pen but is not easily visible, but the patient can appreciate more severe symptoms of itchiness and pain at the site of injection. Injection site reactions can recur even at other sites, and if repeated injections are done at the same site or on the other site, it is quite possible that they may come more aggressively and spread in other areas of your body as well. Some injection site reactions can be just a redness or a swelling. Others can be tenderness at the site of injection. When is it best to avoid the drug? Whenever you find the injection site reaction is not happening at the injection site, but you're getting a rash at areas of your body other than where you have injected, it is best to discontinue the drug. This is mainly to avoid worsening of the rashes and to prevent a major anaphylactic reaction when the rash can affect different parts of your body, including your face, and sometimes even cause difficulties in breathing. These types of drug reactions can even lead to hospitalization and can be life-threatening. And it's best to speak to your physician to ensure that safety is maintained. Most injection site reactions are preventable, and sometimes they do not recur if certain steps are followed. So where would be the best place to inject these medications? Let's have a look at some common sites and tips to avoid these injection site reactions. The easiest and the best site to inject for the first time is on your tummy. You can use a guide from your hand to move away from your belly button to ensure you do not get an injection site reaction. You can use a guide from your fingers to move on either side of your belly button so that you have a clear space. It can be 2 fingers away from the belly button, and you should be able to hold a little bit lump of fat where injection can go perpendicularly. If you're using your thigh, you have plenty of space from your knee up till your groin. However, it's best to avoid any bony parts and ensure that you have got somewhere in the middle of the 2 landmarks. And you have to move outwards where there's more fatty tissue, and you avoid any muscle, and just ensure you're holding a little bit of lump of fat to avoid any injury. Please try to avoid the inner side of the thigh because it can be painful and also cause injection site reaction. You can also use your arm to inject these medications, and you have got the same landmarks from your elbow till your shoulder. However, this is the least preferred injection site because of the fact that you would require another person's help, and you may not have enough fat on this area to inject perpendicularly. It's best to stay in the middle of your arm, not close to the bony marks, and go backwards where there is a bit of fatty tissue and you're able to hold a little bit of fat lump to go perpendicularly and inject in the fat. Minor injection site reactions are common and can be totally avoidable by following the correct site, ensuring that your injection has been removed from the fridge for 30 minutes before usage. Also, applying a little bit of ice pack at the injection site can help. Sometimes you can use paracetamol or antihistamine to prevent the itch and the pain that is happening at the site, but always ensure that you speak to your clinician if they are happening recurrently, and also ensure that you take a picture of your injection site to make a note of its progress and speak to your doctor so that they are not spreading. If you have got a rash at a site other than the injection site, it's more systemic reaction, and that would require discontinuation of the drug. Please ensure that health and safety comes first and you have got supervision of your endocrinologist.